Physical examination is a key skill which will be used throughout your career as a veterinary surgeon and will be an important determinant in selecting diagnostic aids and establishing a diagnosis in veterinary patients. A significant element of the first 2 years of the veterinary course covers anatomy and physiology, and a framework for carrying out a physical examination is being introduced early in the course because the physical examination is essentially just applied anatomy and physiology. Between species, and even within a particular species, what constitutes normal can vary enormously, and in order to become accustomed to what is normal, it will be necessary to examine as many animals as possible over the next 5 years, and it is never too early to start. Personal protective equipment, such as a lab coat or a practice tunic, should always be worn. If there is any likelihood that the patient has a disease communicable to other animals or to people, additional precautions should be taken, and disposable gloves and a disposable plastic apron are sensible. Essential equipment which should always be available includes a stethoscope, a pen torch, and a thermometer. Other equipment which is often useful but will not necessarily be used in every case includes a pair of artery forceps, an ophthalmoscope, an otoscope, and a pair of curved scissors. Physical examination requires you, the student, to develop a number of skills which you will develop and refine over the course of your career. To develop these skills takes considerable practice, and the purpose of this video is to introduce you to the process of physical examination so that you can begin to become proficient at carrying out an examination and are therefore capable of taking as many opportunities as possible to practice. Only by performing as many examinations as possible will you develop an understanding of what constitutes normal, and therefore, in time, the capacity to identify something that is abnormal. Carrying out a physical examination requires the competent performance of a number of processes: observation from a distance, closer inspection of structures, palpation. One definition of palpation is examining something by utilizing the sense of touch. You also need to learn how to carry out auscultation. One definition of auscultation is listening for sounds within the body. It may be performed with the unaided ear or more usually with a stethoscope. Finally, you need to become competent in carrying out percussion. Again, one definition is tapping the body as an aid in diagnosing the condition of parts beneath by the sound obtained. A number of things are readily assessed simply by observing the patient. In fact, some things are best observed before the patient is disturbed. Things such as body condition, the animal's demeanour. Normal animals are bright, alert and responsive. It's also possible to assess gait and movement, and the ability of the animal to see. The rate and quality of respiration should be observed in the patient at rest prior to any hands-on examination. Respiration can vary in rate, depth, effort, and in the relative lengths of the different phases, i.e. the time spent breathing in, the inspiratory phase, and the time spent breathing out, the expiratory phase. An increased respiratory rate needs to be differentiated from panting. Panting significantly raises the respiratory rate, but each breath is very shallow. Dogs often pant in order to cool themselves down. Any attendant respiratory noise should also be noted. If there is clearly audible respiratory noise, can it be localized to a particular part of the respiratory tract? A general review of the head, neck, chest and abdomen, assessing shape and symmetry and looking for evidence of distortion can also be made simply by observing the patient. Having observed the animal from a distance, the next step is to carry out a closer inspection. To do this, it is important to approach the animal in an appropriate way, to get the animal's confidence and have the animal appropriately restrained. Please review the video on dog and cat handling if you're unsure of any of these processes. It's a good idea to get into a routine and follow it every time you carry out a physical examination. For example, it makes sense to begin the examination at the head, having introduced yourself to the animal, and work back towards the tail. It is very tempting to be less thorough when there is an obvious clinical abnormality. Begin by examining the external nares, the lips and the muzzle. These can be observed for evidence of obstruction, discoloration, discharges, symmetry and skin changes. It may be appropriate to find out whether there is air movement through both nostrils. Next, have a look at the eyes and eyelids. Assess the dog's vision. Can it track an object? Does it blink if menaced? Look for symmetry, evidence of discharges, and check the conjunctival mucous membranes. These should glisten and be a healthy salmon pink colour. It is helpful to use a pen torch to assess the iris and the pupil. The pupil should get smaller or constrict when the light is shone into the eye. The front of the eye, the cornea, should be clean and glistening. If a significant eye problem is suspected, particularly one affecting the inside of the eye or the back of the eye, the retina, more specialised equipment such as an ophthalmoscope may be necessary to examine the eye further. Next, lift the upper lip and examine the oral mucous membranes. Observe the colour. Again, the membrane should glisten and be a healthy salmon pink colour. Using a finger, apply gentle pressure to the gums over the root of the canine tooth. This will cause the gum to blanch. When the pressure is released, the colour will return as blood refills the capillaries in the membrane. The time taken for the colour to return is known as the capillary refill time. Lifting the upper lip also allows an examination of the gingiva and teeth. Ensure both sides are assessed. Using the techniques shown in the video on dog handling, open the dog's mouth, assess jaw tone. Is there significant resistance to the mouth being opened? Examine the palate or the roof of the mouth and the upper and lower surface of the tongue. If possible, try to examine the pharynx by putting gentle downward pressure on the base of the tongue. Again, a pen torch is handy. Smell the breath. Is there any evidence of any halitosis? The ears can now be examined outside and in. A pen torch is again helpful for examining the inside of the ear canals. Checking for any odour is also helpful. It's also useful to check the dog's hearing at this time. This can be done by clapping the hands loudly and looking for a response from the dog. If an ear condition is suspected, a more thorough examination of the deeper ear canal will usually be necessary. An otoscope is typically used for this. At this time, otoscopy should be carried out under veterinary supervision only. At the angle of the jaw, it's usually possible to palpate the submandibular salivary glands. Just below and superficial to the salivary glands, it is usually possible to palpate the submandibular lymph nodes. Next, lift the head and inspect and palpate the neck, larynx and trachea. Gentle palpation of the larynx and trachea should not normally elicit a cough. Inspect the jugular veins and note any jugular filling. Normally the veins should not be evident in the jugular groove. It may help to occlude the vein at the base of the jugular furrow and observe the veins filling. In hairy dogs, it will be necessary to clip the neck in order to visualize and/or gain access to the jugular veins. Inspect, palpate, extend and flex the head and neck. Look for evidence of asymmetry, pain or discomfort. Next, locate the front or cranial edge of the scapula. Gently run your fingers forward over the neck in this region, trying to palpate the prescapular lymph nodes. These are often difficult to find, especially in smaller patients, unless they are enlarged. In this case, you can see the nodes slip out from under the fingers. Inspect and palpate the front legs, ideally doing both at once, looking for symmetry. Examine each leg for pain, joint swelling or areas of muscle wasting. Flex and extend all the joints to assess the range of movement and look for evidence of discomfort. You can see from this dog's body language that he resents manipulation of his front legs, and it turns out that this is a consequence of previous injury to one of these front legs. Finally, examine the feet, the interdigital areas, the pads, and expose the nails and examine the nail beds. Next, palpate the thoracic wall, assessing the patient for areas of pain and asymmetry. This will always also give you a good idea of body condition. It should be possible to feel but not see the ribs. Place the hands over the dorsal thorax with the thumbs touching in the midline. This will allow you to assess the thorax for equal movement in both sides and to determine the respiratory rate. The axillary lymph nodes may be palpated on the thoracic wall by running a flat hand into the axilla or armpit. Again, this node can be difficult to palpate unless it is enlarged. The thoracic wall should also be palpated for the apex beat of the heart. If the heart is in its normal position, the apex beat is felt strongest, most prominently on the left side of the thorax, at about the level of the elbow. The apex beat will give a useful indicator of heart rate, of heart rhythm, and it tells you that the heart is in the correct place within the thorax. The heart can usually also be felt, although much less prominently, on the right side of the thorax. Percussion is used to confirm the presence of normal air-filled lung tissue within the thorax. Over the lung fields, a resonant drum-like response should be obtained. More caudally over the thorax, the note is much duller, owing to the presence of the cranial abdominal contents. There are a number of different ways of carrying out thoracic percussion. A simple method is shown here. Auscultation is carried out ideally with the animal standing, nice and quiet and as relaxed as possible, and in a quiet environment. A wide range of stethoscopes is available. Small stethoscope heads, human, paediatric or infant stethoscopes, are very useful in small patients for localizing normal and abnormal heart and lung sounds. Stethoscopes usually have a diaphragm and a bell. The diaphragm is used most frequently and is best for routine use. The bell is useful for assessing lower pitch sounds. The earpieces of the stethoscope only fit in the ears comfortably in one direction, angled forward when placed in the ears. Hold the stethoscope head firmly against the body wall to try and eliminate extraneous noise caused by hair, skin and muscle movement. Auscult the heart, place the stethoscope head over the apex beat of the heart on the left side and listen for normal heart sounds. 2 heart sounds are typically heard in the dog, lub-dup. Over the apex beat, the first sound, the lub, is the loudest. It's also longer and lower pitched than the second heart sound. The head of the stethoscope should be moved gently forward and dorsal into the armpit or the axilla, under the triceps muscle mass. Here the second heart sound, the dup, becomes louder. A link to a recording of what is typically heard in a normal dog can be found on the Vet School VLE. Listen to the heart on both sides of the chest. The 2 heart sounds can be heard on both sides, but are generally quieter on the right side in the normal dog. If the dog is panting, panting can usually be prevented by gently closing the mouth. It's very valuable to palpate the femoral pulse at the same time as you listen to the heart. Every time the heart beats and the heart sounds are heard, a pulse should be felt. Next, the lung fields are ausculted. The presence of the triceps muscle mass cranially and the cranial abdominal contents caudally means that the area over which the lungs can be heard is quite restricted. Listen over the lung fields, dorsal and caudal, to where the heart is audible. A small amount of respiratory noise is usually audible in normal animals. Take your time and listen to a number of sites on both sides of the thorax to ensure a thorough evaluation of both lung fields. Again, a systematic and consistent approach is useful. Don't forget to auscult over the trachea and the larynx as well, trying to identify noises emanating from the upper respiratory tract. The surface of the abdomen is palpated and inspected. The mammary glands in the bitch and the penis in the dog can be examined at this time. It may be helpful to restrain the dog in lateral recumbency to examine these structures. The abdominal contents are assessed by careful deep palpation using gentle fingertip pressure. This requires considerable practice. In the early stages of learning this particular skill, be very gentle. Structures should be gently traced, not grabbed at. Abdominal palpation can be carried out using one hand in small dogs and cats, or two hands in medium-sized and large dogs. It's a good idea to begin examining the cranial abdomen and work backwards. Use one or both hands according to the size of the patient. Run the hands gently off the back of the rib cage ventrally and palpate the contents of the cranial abdomen. The caudal border of the liver may be palpable if the liver is enlarged. The spleen may be felt on the left side, again most easily found if it is abnormally enlarged. The right kidney is cranial to the left and dorsally placed. It may be possible to feel the caudal pole of the right kidney. The left kidney may be palpable in the dorsal cranial left abdomen. In the mid-abdomen, it is usually possible to run intestinal loops through the fingers. In the caudal abdomen, the bladder can be palpated ventrally depending on the degree of distension. The uterus may be evident dorsal to the bladder in the bitch, although it is usually only identifiable if enlarged. The colon can be palpated in the dorsal caudal abdomen. Getting an assistant to lift the front end of the patient may allow better access to structures in the cranial abdomen. Similarly, getting an assistant to lift the back end of the patient may allow better access to structures in the caudal abdomen. Inspect and palpate the back legs, again ideally both at the same time, looking for symmetry. Examine each leg for pain, joint swelling and areas of muscle wasting. Flex and extend all joints to assess the range of movement and look for evidence of discomfort. Finally, examine the feet, the interdigital spaces, the pads, and expose the nails and examine the nail beds. It may be possible to palpate the popliteal lymph nodes, which can be found just behind the stifle joint. Again, these may not be palpable in small dogs, and they're usually only readily palpable if they are enlarged. The best site for palpating the pulse in the dog is the femoral artery, which can be found by running the hand inside the upper thigh. The pulse rate can be taken and the rhythm assessed. Some assessment of the quality of the pulse can be made. Is it full or weak, for example? It's useful to get into the habit of palpating the pulse in both hind legs at the same time to compare the two. Inspect the tail, perineum, anus, perianal area and external genitalia. Again, the genital mucous membranes can be assessed. Now is a good time to take the rectal temperature. The skin should be assessed regionally as the animal is examined. Over the neck, it is helpful to assess skin turgor, which is a useful indicator of the state of hydration. It is also useful to examine the skin of the ventral abdomen with the dog in lateral recumbency, and at this time the other ventral abdominal structures such as the mammary glands and the penis can be examined. An examination of the nervous system may be indicated by the history or findings on full physical exam. However, it is useful to get into the habit of checking conscious proprioception as part of the routine physical examination. This is done by knuckling the feet and checking that the dog can replace the feet appropriately. In some cases, a rectal examination may be useful. This can give some assessment of the intrapelvic structures. For example, the prostate gland in the male may be assessed. Rectal examination also allows an assessment of the quality of the feces. Again, rectal examination is rarely part of a routine physical exam, and at this stage should be carried out only under veterinary supervision. Finally, weigh the animal, and on completion of the examination, make sure you wash your hands. We hope that this serves as a useful framework on which to begin to develop confidence in carrying out a physical examination in the dog. Much of this has relevance to other species as well. It is impossible to describe all the variations of what is normal. and it would be particularly difficult to describe all the possible abnormalities that could be encountered in clinical practice. Using the framework described, it's important now to spend as much time practicing the procedures as possible and learning what is normal.